This is how Jenna Morazzo and her boyfriend Cody spend a Saturday afternoon.
It's just nice because it's so peaceful and it's so beautiful out there. We usually go to lakes to kayak. I'm not adventurous enough to do rivers, but I do enjoy just like the peacefulness of the lake setting.
It's just a way of getting out of the house once in a while and spending some time with each other because life's so busy all the time.
A time to relax and be carefree. 3 years ago, Jenna was anything but relaxed. She went for a routine MRI to check on a congenital condition.
So I was diagnosed with Chiari malformation, which is where my cerebellum extends out of the base of my skull, and it's almost touching my spine. They just kind of said to keep checking up on it, so I got MRIs every 4 years, every 4 or 5 years after that.
The Chiari malformation looked no different, but there was a very subtle area in the left part of the brain, in the front part, that was just a little abnormal, a little kind of different signal that we would say on the MRI, just subtly different. Her history was also very relevant here. Her family history was that her father had passed away from a malignant brain tumor when he was relatively young. And so that combination of findings, I think, raised enough of a degree of concern that we said, we're concerned that this might be a tumor.
So I don't think it fully registered at the time, but I did call my boyfriend Cody when I found out, and I told him.
We wanted to take the next steps as soon as possible to find out what it was and then figure out what we could do about it, what were our options.
Given how young she was, given her family history, and given the change that we had seen over time, we recommended surgery both as a treatment and to confirm a diagnosis.
The next step was to pick a day for the surgery, and then they would take the biopsy after the surgery when it was removed, and then we would make a plan from there.
So this is an operation where we open part of the skull or the calvarium to access where the mass is. But the difference between this and a lot of the standard operations that we do is that we do this with the patient awake. And that affords us the ability to monitor and preserve their speech and language function.
I was okay after that first night. I was a lot better. I was like myself. And then the second day, that morning, Thursday morning, they told me that I was going to go home that day.
A couple of weeks later, Jenna received the results from the biopsy.
This was a grade 3 tumor. It was called an anaplastic astrocytoma. And what we know of these tumors is that they can get more aggressive over time.
We didn't really think that she could get cancer at such a young age. Maybe later on in life something could happen, but like so early, it's like, that can't happen. You know, that's what we thought.
So then from there, the plan was kind of, okay, well, now that it's malignant, he recommended radiation and chemo.
The goal of doing that is preventing this from coming back. That we know that despite surgical removal, there's a high risk of recurrence or return of the mass, and we want to minimize that risk.
So I did 6 weeks of chemo and radiation together. And then after that, I did 6 rounds of chemo. So it was for 6 months afterwards, I had to take chemo for 5 days out of the month.
Since then, Jenna's scans have been clear.
You know, it doesn't have trouble with really anything. I mean, it's basically like the surgery never happened kind of thing. Like it's like she never had a brain tumor.
I feel really good. I mean, positive news is always good news in my mind. But throughout the whole thing, I just tried to remain a positive person.
She's doing really good, and we're very happy that she's doing good, and we want to keep it that way.